I don't want to take my chances. Like there are drugs to like help to control like whatever is going on with me or like pain or whatever. So it's only natural that you will go and surrender like to the physician's opinion.
Just following that approach.
Correct. And what is mind-blowing in reality is that families that they struggle with money, with finances, money or career or anything money related becomes a source of stress. I can cite the words of Bruce Lipton, for example, that does research, is a biologist, that like he'll say that absolutely everything, including genetic issues, the genetic mutations have roots in.
Hey guys, welcome to the podcast, I Need More From You. I'm your host, Dr. Kristen Oakes. This podcast is meant to be both educational and entertaining. We're diving into all things health and wellness along with life because let's be honest, we all have more to give. Just real talk, real life. This is your space for laughs, learning, and leveling up. So buckle up and let's thrive. No excuses. Hey guys, welcome to this week's episode of I Need More From You. I want you guys to meet Diogo Trevisan. He is an orthopedic expert. He's also the owner of Physical Therapy Now, Sunset. He has over 14 years of experience in the field. He's written a book, Inner Vastness, Healing from Within. We're definitely going to talk about this today. And Diogo is redefining healing by merging physical recovery with emotional and mental well-being. Get ready for real talk on stress, chronic pain, and how to unlock your body's natural power to heal. Diogo, thank you so much for joining me today.
No, thank you.
I am really excited about this episode together. I met Diogo back in 2017. We were working in physical medicine rehabilitation at the time. And if you would have told me then that we're going to be sitting here 8 years later doing a podcast together, I would definitely think that you're crazy. Definitely. But I knew you were special from when I first met you. Then my husband and I always talked about him. We were like, man, that guy's special. Not only like your bedside manner with patients, but how you practice. And I just knew that you were definitely going to be doing great things. So thank you for coming on the podcast. When you told me you wrote a book, I was just like, what the heck? This guy is a rock star. So we definitely want to, touch on that today, but just thank you for joining us.
No, thank you. It's really an honor. I've wanted to talk about it. So, it's obviously just waiting.
This was like perfect timing, right? Yeah, perfect timing.
It was great.
Okay. So I'm just going to put it here because it's super cute and we want everybody to see your book on display here, and we'll talk about where you can get it and stuff like that. But before we jump into your book, 14 years in the field of orthopedics, like how did you even get started in physical therapy?
So looking back now, I see that I wanted to be in the health business, not in the treating disease business. It wasn't clear to me in the beginning because my grandpa is a physician and he was like one of my heroes. And my first option was psychology. Okay. And then my dad gave me a hard time.
He's like, you're not doing that?
Gonna be a psychologist, yeah. And I'm like, yeah. And he's like, that's terrible, and he's like, you're not gonna make any money or whatever. And then he got on my case, and I didn't have like the best relationship with my dad. So I'm like, okay, so I'm gonna have to think of something else. And in Brazil, when you're getting your driver's license, you have to go through like an entire week course, like to get your license.
Wait a minute. Okay, you said Brazil, and a week course to get your driver's license. Yeah. We have to go through like many weeks here in the United States to get a driver's license.
What?
We have to go to driver's ed. It's like many weeks.
What? I got my driver's license in one afternoon.
Okay, this is exactly the problem with the Miami drivers. This is why
Yes.
foreigners coming into Miami and y'all can't drive because you get 1 week of training.
No, one afternoon.
Oh my God.
I got my driver's license in Miami.
Oh
In
my
the
gosh, that's
Bank
hilarious.
of the Mall of Americas in one afternoon.
Wow.
One day.
You
In Brazil's a week.
Oh, okay, so that's a little bit better. You drive better than most Miamians. How about that? Okay, sorry,
Never
I
had
digressed.
an issue.
But you grew up in Brazil, and then you moved to Miami.
Correct.
Did you go to school in Brazil or here?
In Brazil.
Okay.
And then I validated the license in 2016. But then in 2018, I did a doctorate.
You're so
Utica.
amazing. This is Dr. Trevisan, okay? Get it right. Dr. Trevisan, physical therapist. He's amazing. All right. So your dad was like, no, psychology's not happening. You were like, okay, so what else am I going to do with my life?
So when I was getting my driver's license, I remember my instructor. And I remember like I have this image of like where I was sitting in class because it was so remarkable looking back. He was explaining how firefighters will give their life for you. And then he compared with other professions. Like, do you think your physician cares? Like, do you think he's going to leave in the middle of the night to treat you or whatever? He's like, firefighters will give their life for you. And at that moment, I was like, like something like struck a chord because like I wanted to help people. I wanted to be in the health business. You know, it wasn't medicine. It wasn't clear. And then I started researching and I'm like, okay, then maybe like something with the body, but promoting health or whatever. And then physical therapy was the closest thing to it.
Okay.
Yeah.
So that's kind of how you got started with physical therapy. And then you just gave us the backstory. You transferred to the US, you got your doctorate, and then you were practicing in more, would you say you just started in like more Western medicine practicing? Have you always kind of had this more holistic spiel into how you practice or?
So I've always had the holistic side because I would say I've been in like my own personal like spiritual search since I'm a child. Like I've always been obsessed with the idea of like higher consciousness and what comes after. So I've always had that in me. But in the beginning of my career as a PT, it was just classical orthopedics with my own personal touch to it.
Of course, right. And I remember seeing that because of how you like cared for your patients and stuff. I was like, man, this guy's definitely different. You're not just like cookie cutter by the book, you know, standard Western medicine. You definitely put more thought and care into your practice and how you were treating your patients. So I knew you were going to do great things. Okay. And then you opened up physical therapy now,
Correct.
The Sunset location. When did you do that?
So the idea came up like July-ish 2019. January
Wasn't
2020.
this was like COVID time?
Yeah.
Yeah.
But when I got my keys, like
Okay.
literally my landlord said, okay, the place is yours. And I obviously had to flip and pass inspections and all
the
that stuff,
things.
you know,
Yeah.
get my permits and COVID hit. And then
You're like,
my
what the frick am I going to
workers,
do?
my architect disappeared, my GC. And so I started like emailing the landlords and they wouldn't compromise. They're like, you're on your own. In July, it kicks in, figure it out. And it worked. I was done by July, opened my doors, started with 4 patients.
You go, rock star.
And now we're seeing like between like 50 and 60 patients
That's
in
amazing.
one day. So
That's super cool.
and obviously with a bigger team.
Yes. And you're still in the same location?
Yeah.
Okay. And your wife, she does anesthesiologist or
Correct.
something with anesthesia? Yeah.
She is an anesthesiologist assistant. She's actually at the hospital right now.
She's amazing
But-
too.
Yeah. But she runs the clinic.
Okay.
So we used an EMR that was brand new, and we found out later that we were the only users for the EMR.
Okay. This
And
could be a good or
then-
bad thing.
Bad.
Okay.
We had like a year and a half of claims that never got paid.
You're
so we just
kidding.
kept like bleeding for like a year and a half. And when they went out of business, Steffi had to learn so much about like denials and how it works or whatever, that like a year later she was better than like she was teaching the team like what to do.
How to do the billing side of
Right.
it.
And then she just took over. She's like, let's get a new EMR, but I'm going to do it. And like nowadays, like we talk to friends that own clinics, have owned for longer than we have, and she'll teach them stuff about.
So y'all are
the in and outs.
consulting medical billing as well.
Yeah.
You better have like an LLC on that and be getting paid for this.
No.
What?
We do it like just to help out.
Out of love. That's
Yeah.
amazing. They're so kind. Like them two, and then, you know, they have 2 boys together, and it's just super amazing. Okay, so power couple, you opened up physical therapy now. Y'all have been crushing it over at Sunset. And are you still like in the day-to-day grind? Do you have other physical therapists, or is this like you like little mentorees? How is this working over there?
I always thought that I was going to transition to more like mentoring, teaching type of thing, but I can't stay away from hands-on. Like it's impossible.
Yeah.
It's a sense of mission because I love, like when my patients get better, I started posting text messages, you know, of people that get better.
Success
like overnight.
stories.
Exactly.
Uh-huh.
And people say like, at the same time, like I'm helping someone that has like chronic pain and they're healed the next day. And I feel like I'm selfish because I like it so much. Like when I get that text message, like,
You're like, yeah,
no pain. I'm like, yes.
Thank
I haven't
goodness.
lost the touch, you know?
Right.
So I absolutely love what I do. I love what I do. But obviously I like doing it on my own terms. I still deal with frustrations when it comes to like the pressure of like running the clinic and like bureaucracy, paperwork, you know?
Of course.
But
That's where Steffi steps in to help.
correct.
Yeah.
But the hands-on treating patients, I love it.
You get to do what you love, and she does all the back end
Exactly.
hard stuff.
Yeah.
I know what you do is hard too, but you
Yeah.
know, all the other stuff that goes into
I
it.
do have some management roles that I don't love.
Setting the schedule.
No.
Okay.
Hiring,
Oh,
firing
Firing
sucks.
is so bad. It never gets easy, and it's the worst.
And we made the mistake. It's not a mistake, but we created like this family culture where the employees have come to my house several times. We go out together.
You've
and
crossed
stuff,
those boundaries.
You know? Yes.
So that makes it hurt worse.
Yes. But we have an amazing team. Like they're super mature. They're extremely respectful with me. So I never saw the problem. There was never an issue where they cross the boundaries in the sense of disrespecting that, you know,
Or like taking you guys
relationship.
for granted.
Exactly.
Yeah.
Never.
Okay.
But it just makes it so much harder. Like if I have to make a decision like that, you know, if I have to let someone go. So
Yeah, because you know
hard.
more than just like them from the work side of it.
yeah.
More of a personal connection that you guys have developed. But that also is kind of what strengthens your clinic, because you do have that family dynamic, you know, of
Exactly.
how y'all interact with each other, treat your patients, or more of a, I guess, home, like a
Yeah.
homey approach
Yeah.
than just kind of like sterile, raw clinical.
Yeah.
You know? So for physical therapy now, would you say your approach at the clinic is more like westernized, or are you incorporating more of the holistic approach into how you're treating your patients, or do you have to follow like set protocols and stuff?
Both are true.
Okay.
So they're not disconnected. And when I tell stories of how I incorporate it, it's a little bit easier to understand.
Okay.
So I can tell you like a quick story.
Let's do it.
Because our practice is westernized, quote unquote. My practice is mainly orthopedics, right? Surgical reconstruction, trauma, pain. But the way I bring this element of emotional health, like I can give you an example. This patient comes in, she's getting better. I'm treating her low back. And then 12 sessions in, she's usually the type of patient that comes like singing, talking to everyone, super happy and stuff. And she's like 80 years old.
Aw.
She looks like she's like 59.
Okay. I want to be like her.
Super strong. No, amazing. You will be.
80 and 50, looking
Yeah.
59. Yes.
Yes. And this day, I noticed that she walks in and the light is not there. So
Okay.
it just stroked me. Boom. So there's like when you call holistic, there is that too. Like my perception, it just didn't look right. But whatever. I go, I say hi. She's like, hi. But she's not like her singing, bubbly self.
Yeah.
So when I bring her in, I'm like, how's your back? And she's like, I'm not feeling better. And again, this is weird. I'm like, this is not her. She's been getting better. And I'm like, show me where the pain is. And she shows me a different spot. And I tell her, I'm like, but we've been treating kind of like the lower part. How is this part doing? She's like, no, the pain was never there. It was always here. So it's not really adding up, but I'm like, okay. So I'm like, look, I'm going to treat this part where you're showing. I'm going to still treat what we were treating before. Let me add some molds. I'm going to add some stuff. And you tell me how you feel in the end of the session. Good. Okay. So I go, I'm working on her. She's facing down. When I'm going to do her stretches, she turns facing up. Then it definitely like clicks for no reason. I just look at her and I'm like, there's something wrong with her. So before starting the stretches, I just look at her and I'm like, are you okay? And she says, yes, and looks away. And I'm like, like she avoided eye contact. And I'm like, it looks like something is really bothering her. So I kind of like lean on the edge of the table and I just put my hand on her shoulder. And I felt that thing like coming up. She started crying. Crying. I give her like a little towel. She covered her face and she's like, I'm so sorry. I'm so sorry. I'm like, look, you don't have to apologize. Your emotions are welcome here. You know, you're fine. So I bring her to my office. I'm like, come in so you can, you know.
Have your space.
Yeah. So she came into my office. I sat next to her. She cried for another 5 minutes. I didn't say anything. I just stayed there. And then she turns to me and she says, you know, it's really sad when your kids fight for stupid stuff, you know, material things, money. She's like, as a mother, like I get so sad. So there was something like devastating her inside. And since she has like this bubbly personality, it's all good.
Right.
Some people don't give way to the emotion, like they don't feel it, right? So there's a whole chapter, correct. There's a whole chapter in my book about unprocessed emotions.
Okay.
It can be more bizarre than that, but it's a perfect example, right? So, and also how I approach that, because I didn't do anything. It's more like the sensibility of understanding that there's something going on. So when she finished crying, you know, she said all the details of what was going on. And then she's like, gave me this huge hug. And she's like, I have absolutely no pain. She's like, my back is awesome. She's like, your therapy is physical and mental, spiritual. She's like, oh my God, I'm so glad. Can I go home? I'm like, yeah, it's fine. Take the day off. So she went home like super happy.
You're like, bye.
You know? Yeah.
Oh my, she just needed to like express that, get it out and let it just rear its head, right? So for her, it was triggering as a different pain point.
Correct.
Okay. And so with that, you just kind of, was that your turning point when you were like, we've got to, you know, I need to write a book on this?
No, there was a story before that. The remarkable one that I remember, the same thing that I said about the driver's license day, where I like super like remember. About 2011, I was still working as a tech because I didn't have a license. So I was just there like helping out on the physical therapy setting. And this patient comes in and I was helping in an eval, but she had this chronic headache and she was hospitalized for like a week on morphine.
Wow.
She was dealing with it for the past 6 months. So long story short, she had like a million MRI, CT scan, blood exams, like everything.
Trying to figure out what's going on.
Didn't find anything whatsoever. And when everything failed, she tried like psychiatric medication and injections and a whole bunch of like heavy stuff. They diagnosed her with occipital neuralgia, and what she was showing like didn't look like anything like occipital neuralgia. So when she came to me, she's like, what's your opinion? I'm like, it does not look like occipital neuralgia.
It's not presenting as so.
Yeah.
Okay.
And she's like, what do I do? I'm like, look, I won't be able to help you with that. So it's always like full disclosure if I need to touch on the subject. And I'm like, but there is this whole science that unprocessed emotions can cause chronic pain. And I'm like, are you under some stress or anything? She's like, no. She's like, I love work. Family's fine. Everything is good. So I'm like, is there anything from the past that could be bugging you? And immediately like tears came up and she's like, I don't want to talk about it, but there's definitely something. I'm like, again, I'm not qualified to work with you on that, but I highly recommend you speak with someone, like work on that, because it could be the cause of the symptom. So we were close because it was a holiday, and I saw her like a week later. She came back and she tells me, I haven't had any headache since we had this conversation. And I'm like, what happened? She's like, I got in the car I started crying, like everything came up, like the emotion, and it just made me realize like how old I was and how much I was like holding it in. And obviously I started like working on it, I called my therapist or whatever, but that was a turning point. I was like,
This is deeper, and more people are struggling with this.
Yeah.
And their symptoms present differently.
Correct.
Interesting. So that is what you're like, okay, I've got to divulge into this topic and really, dive into, and I want to write a book about it. Did you know you wanted to write a book?
Always.
You've always wanted to write a book.
Always, yeah.
But you just weren't sure what you were going to write it about.
Correct. So I've had like 2 or 3 first 3 chapters of my books that I never finished. It wasn't the right thing.
Okay.
When this one came up, it was almost like it was like super fast, because like I had everything. Like I write, I journal. When I have like some realization, I write it down. When I make something complicated, like simple, I write it down the simple way that, to repeat to my patients, or when I have like insight. So I pretty much had everything. I just picked up everything I had, divided into chapters. And technically the transition, like what made it easier is I was invited to give a lecture at FIU about this.
Okay.
And the way I prepared the presentation, it had to be an hour and a half long. I had to make it very simple for them to understand. And then that helped me to organize.
Organize your book.
Yeah.
Okay, so you've always been writing, and then you would just get a couple chapters in, and you're like, this isn't it.
Yeah.
But you still had the material.
Correct.
So then when you were going to do the lecture and you had to format it a specific way, you're like, I'm going to actually fill this out and write the book about it.
Exactly.
That's super cool. So when did you, Inner Vastness, Healing from Within, when did you write this? When did this go live, I guess I should say? Or are you even live yet? This is just newly published?
Yeah, it went live a few months ago.
Okay.
And it's on Amazon.
Okay.
When I say it's like brand new, I don't know if it has to do with like algorithm, but when I search my book, I don't find it. I have to find a link that I use for like author's copy and stuff, and I've been sharing on Instagram. So people that have bought it because I posted on my Instagram.
So we need the link to the book, so we can definitely put that in the show notes.
Right.
Okay. And that way we can get it back and get it in the Amazon algorithm so it's stronger and shows up.
Yes.
Okay, so you were preparing for your book. Did you discover anything within the research or while you were developing it that surprised you? Or was this like, I knew all of this, I just needed to piece it together and put it out so other people can learn from it?
No, I think I'm constantly being surprised, like in my own experience. So the most recent book, believe me or not, that is extremely scientific by Dr. Lisa Rankin. She's an MD. It's called Mind Over Medicine. I mean, it's mind blowing. Like, she will research in scientific journals and like only like official sources, scientific sources, big universities, and she's specifically talking about the placebo effect.
It's huge.
The power that the mind has to heal. And it's like, amongst other bizarre things, is like stage 4 cancer disappearing, capillary growth, like hair growth, which is against everything we know. Like when you don't grow hair, you just don't grow hair, like kidney regeneration, eyesight regeneration.
Because of the power of the mind.
Correct.
I think this is super interesting because when we were actually driving to this podcast, my husband got a phone call, and somebody that we know, their father has been diagnosed with CLL, so a form of cancer, leukemia. And, he was having a conversation with him about it, and he was just kind of talking to him like, where is your dad's head at as far as, where's his mindset? Because some people, they get a diagnosis of cancer and they just kind of give up, right? Like they don't want to do that fight. And then it's kind of like they would be better off with their overall longevity if they never even knew that they had cancer. So it's just, he was just referring to how that mindset comes into play as far as your overall healing, not just for cancer, right? Yeah. But, you can see it with so many different things, hair growth even, and that placebo effect, or just having that mindset of what you want to change. Yeah. So that's just weird that we just touched on that, and he was talking about that on the phone, but it's so true.
So Lisa Rankin also talks about the nocebo effect.
What's a nocebo effect?
Is the opposite. When you go to a doctor, and I mean, I can say like a great part of them don't really care about human beings. And he's like, you have 5 months to live.
It's a sick system, not a health system.
Yeah.
Okay.
And they'll say something like, you have 5 months to live, and 4 months and 29 days, and 1 day later the patient dies. You know, like nocebo effect, like 5 months because the doctor said so. So there's a hierarchical, like in a way, like just the way medicine hierarchy works, you know, like physicians studied the body physiology and pathology for so long that you're like, I don't want to take my chances. Like there are drugs to like help to control like whatever is going on with me, or like pain or whatever. So it's only natural that you will go and surrender like to the physician's opinion.
Just following that approach.
Correct. But historically, people have like completely surrendered their health to the physician. It's almost like I have patients, which to me, like it just blows my mind. To this day, patients come with a surgical procedure and they have no idea what was done. And I'm like, I mean, I understand.
That's sad.
Yeah.
That's really sad.
Yeah. I understand if you don't repeat the correct terms, or if you tell me he went in, he took a little piece out, he sewed something back together, then I get it. Like you're not telling me like technically, but you know what was done and why. The gist of what's happening. You know?
The left shoulder.
Yeah, exactly. Yeah. Injections, they're like, oh, he injected me with something. Like, what did he inject you with? And they're like, I don't know. And I'm like, if I take a pill from my drawer right now and I say, take it without telling you, would you take it? And they have like a moment, like a pausing. And I'm like, how do you let someone just put something in you that you have no idea what it is, you know? So again, like they may have all the best intentions and it was great for their treatment and everything, like perfect in a perfect world, but you should ask. You should know. You should be part of the treatment, questions. You know? So
yes, you need to know what's going on with your health and not just assume that because, you know, you're seeing a physician or whatever, that I feel like they have good intentions, but I don't feel like maybe it's, what is the word I'm looking for here? Like you're just stuck in this repetitive cycle of the treatment protocol that you know, versus being open to alternative modalities and things like that. Like, oh, you have high blood pressure? I'm going to give you losartan or blood pressure medication. Correct. Versus let's talk about your diet. Let's talk about your lifestyle, your exercise routine, what supplement regimen, what does your labs look like? And maybe that's because you don't have the time, or maybe it's because like you were taught ABC and I'm going to stick to ABC.
Correct.
Right?
Yeah.
So I totally get that.
And that's an example that I give my patients when I talk about emotional health. If you can do like the whole like love, connection, like listening, like you don't even have to. Just care a little bit about your patient, that will do it. Because if there are chronic headaches, cephalea, that starts from stress, right? And it could be postural, but it's stress related. Work volume, lack of exercise, eating like crap, dehydration. So the person will go to a physician, like they'll immediately just prescribe some meds. They're not going to ask a single question, right? But then when you don't change the stress, now the pressure start rising, and then they'll give them losartan.
Yes.
And then eventually it's an acid reflux, and they'll give them some omeprazole. And then something else breaks and they give something else, and something else breaks, they'll give something else.
You're putting a bunch of Band-Aids.
Exactly.
But you're not treating what scratched the knee. And I probably say that saying so many times a day to patients. I'm like, we want to focus on what actually scratched the knee versus just putting a Band-Aid on it. Because it's so easy to just, let me prescribe you, get out of the office, move on to the next patient. Yeah. But you're not helping them. They're going to be back in 3 months with a new symptomology because of that first medication. It just kind of starts a ripple effect, right? Yeah. So, okay, physical therapy. Well, before I go there, what is one thing from your book that you could just short and sweet that people can learn from or take away from that? What would you say is like highlight? Inner Vastness.
Understanding your mind is like learning how to play chess.
That's hard.
Yeah, it is. And it's not even a fair comparison. The mind is way more complicated.
Way more powerful too, right?
If you sit to play with a professional chess player, your chances of winning are slim to none. If a white belt rolls with you, the chances of them submitting you are slim to none. But what does that say? There is a technique behind something that you need to do and perform.
You need those tools, right?
Exactly.
Okay.
And it's no different when it comes to like mind and emotional health, right? So in short, my book can give you tools to like understand like what's going on, what the process is, like trauma, your body, why you feel anxious when you don't even know why. Like you're sitting at home watching TV and you get an anxiety attack. How you can manage stress.
Okay.
Where you start from in your journaling or self-assessment, or what you can do with your own body to like rewire stress.
So it's kind of like helping you identify possible causes, how to process those causes, and things that you can implement to overcome the different symptomology. Yeah.
Understanding, analyzing, and fixing. Everything is here, but like I made it extremely simple on purpose. So
that everybody can grasp it, break it down, and utilize it.
Yeah.
Okay, I love that. I think that's super important because like what something like me and you might understand, everyday people might not be able to break it down and digest it. Right. So you have so much knowledge, but having it in a way that's digestible for the everyday person is what's hard to translate that. So for people that are, great teachers like yourself, you can break that down into a manner so people can actually do something with the data or the information, I should say, that you're sharing with them.
Exactly.
Love that.
Yeah.
Okay, physical therapy. Would you say that everybody can benefit from physical therapy, or like only if I have an injury to my knee or something, I need to come and see you? What's your take on that?
No, everybody, like I said, we're in the health business. We do prevent injuries. So there are injuries that we can foresee before any pain or anything. Like there's, from muscle imbalance, tightness to capsular pattern, or, little pains and aches here and there, like can signal to something that needs to be addressed. Yeah.
Okay. Would you say, like, what would be a typical prescription for physical therapy, or like how many times should someone go and check in with a physical therapist for if it's like a postural assessment, or how many treatments should they expect if they're going for that? What would that look like?
Yeah.
And that's kind of like really varies, right? Depending on,
exactly.
But what would you,
but
how can you summarize that?
It's important to address because it's different for the sedentary patient that works out regularly. So meaning their main occupation, their main profession doesn't involve beating their body, like someone in construction has to like carry heavy stuff and be on their knees and stuff. It's different from a fighter, professional fighter. It's training like 5 hours a day, 6 days a week.
Strenuous.
And so it varies. It could be as little as once every 2 weeks, once a month. I have people that call me when something feels out of whack slightly, and it could be like once a month, and it's just enough for them to keep up if they're doing their part.
All the other things like at home.
Mobility, exercising,
Okay. So it really just kind of varies. Like, it's good to just go and have that check-in to kind of like, man, my shoulder's kind of bothering me when I do this or whatever, to kind of just keep it, I guess, more of a corrective or preventative approach before it gets to an extent where it's time to go, have injections for chronic knee pain or whatever. Right? Yeah. All right. So what is the most common way you would say that you've seen in practice that stress shows up physically in your patients?
In my opinion, the most common is cervical, upper trap, and TMJ pain. That's the most common. Like from a block away, when patients come in with those conditions, I can tell they're under some heavy stress.
So you're saying like neck. Let's break this down if you don't know what cervical and trap. Okay, so like neck and upper shoulder pain.
Correct.
Or like in the jaw.
Yeah, jaw.
Would headaches coincide with that, or would that be separate?
Yeah, but the headaches alone, not so much.
Okay.
I had that case that I told you that really was a turning point, but it doesn't, turn out to be like a main one. But
stress is the neck and
upper shoulder, and Jaw is like,
I think that's just like the clenching
yeah,
from the stress.
yeah.
Okay. Okay. So neck, traps, and the TMJ, most common that you have seen in practice of how stress correlates as far as chronic pain. Okay. What would you say to someone that's skeptical about, oh, their emotions are what's triggering their back pain?
Okay. Is that okay if I expand a little bit on the concept?
Yeah, for sure.
So here's what I found out about stress. Because when I learned stress, I learned the physiology, right? We have an adenohypophysis in the middle of the brain that release ACTH, adrenocorticotrophic hormones, go to the adrenal glands, and there are 3 sets of hormone, mineralocorticoids, catecholamines, and corticosteroids. Those adrenal glands hormones can change everything in the body. Like you can explain any condition with this stress reaction, right? What I got super interested in is, what is stress? Is stress only when your boss is yelling at you, when you're really like facing the lion? Because we fight lions in our head, not really like our stress and like the dangers that happen like in the world. They're 99.999% in our mind, right?
Right.
And this is what I found like through the years. Right? I've been studying this for almost 2 decades. And when we're babies, we're pretty much a blank canvas. So mainly from observing mom and dad, and then obviously close relatives, school, friends, and so forth. So what those messages do to the nervous system is they program you to filter what is safe and what is not safe. And what is mind-blowing in reality is that families that they struggle with money, with finances, money or career or anything money related becomes a source of stress. Like it's dangerous. They won't make a move. They won't invest. They won't like do anything that puts like their money at risk or anything, right? Sometimes it's relationship. The single mom that raised all the kids and say, I don't need man in my life, and is like, I'm super powerful. They may be that woman that becomes like extremely successful, like superpower, but just like step on men and is like, I don't need you type of thing. So obviously there are a million different cases.
Yeah, for sure.
Or something extremely serious, like a real trauma, like a kid that is violated sexually, and the trauma can be so bizarre that the kid completely forgets the experience, and then later on he or she will be diagnosed with some maniac, suicide, depressive condition, like something like heavy.
Because it's been suppressed.
Exactly, because it's been suppressed. So when I'm talking to a skeptical patient, still to your question, like if they're open, right? Because I can force that concept on someone that is not interested at all, because
Yeah, they have
no
to have to
follow-up.
be receptive to what you have to say.
What I do explain to them is that science shows, and this is not only in the psychology, psychoanalysis lore. Now, biology and neuroscience shows that unprocessed emotions can cause disease and chronic pain. And I have to explain to the patients that by unprocessed means you have no idea. You don't know where it started. You know how far back it goes. And sometimes we don't know. So somatic therapy is fascinating because they'll bring out the emotion even if you don't know where it comes from.
What do you mean somatic therapy?
So
Explain
there's
that.
like a whole kind of like section of like working with emotion that they call somatic therapy.
Okay.
Meaning they'll stimulate like, body breathing movements or something to bring out emotions. And then you may re-experience an emotion that was just stuck in the body.
Okay. So it's like a way to elicit it.
Exactly.
Makes sense.
Yeah.
Okay. So I guess to answer that question, you're just kind of recapping here. Patients that are, you have to be receptive to it, right? And those that are skeptical, you kind of just touch on it. First of all, you're just assessing them, and if you don't see anything physically wrong, is that what kind of makes you, I guess, lean more towards that? Well, maybe this is just an emotional trigger that's causing them to have that pain?
Correct. That's a hard one, though. It's hard to answer because at times, like, there are patients that come with such a wall, like it's impossible to penetrate. And there are patients that even though they have a wall, like, I just have to use the right words to bring out, you know? So one of my patients spent the whole first like 10 minutes of the session. She had the neck pain, the traps, the TMJ, classical stress. And I told him, like, this is stress related. She's like, no, I don't have any stress. And I'm like, look, let me just explain, because this is just for you. You're the one that is going to take this with you, almost like a homework. Think about it, digest the idea, but there are emotions that may not be processed, meaning you're not dealing with them, you're not feeling them, they're buried somewhere. But you could, through therapy, and you may need some help, you're not going to do it on your own, but work on that and release that. It can only help you, right? And so she had the wall, and she's like, I have zero stress, I don't have any stress. And then I'm like, okay, and sometimes I have to go like from the outside, like kind of like
take the back roads.
Take the back roads. And I don't remember honestly how it led to that, but I asked her, I'm like, where are your parents? And she choked. She didn't answer. She choked. And I was like, I'm like, I think I found something there, like a thread, right? And she's like, and she started choking. And when she tried answering, she started crying. And I have
tissues,
you know, right next to the desk.
Yeah.
So I'm already like, and she would not stop crying for like 5 minutes. I have no idea what's going on. And then when she catches her breath, she's like, you know, and then she goes back to like childhood and my mom and my dad. And then, so the mom was sick and she had to take care of the mom, and she had like no social life whatsoever. And something like the dad committed suicide.
Something hard.
And you know, so the whole time I'm like, but she's fighting me on the stress. She's like, no, I don't have any stress. So I'm like, so I just highlight, I'm like, this is a source of stress. It's really difficult, like, not to have time for yourself and care for someone that you actually love, and see the person like deteriorating. Like, this is huge.
Yeah,
it's
it's
huge.
a big impact for sure.
So, yeah.
Just kind of highlighting it in a different realm, right? Because a lot of people don't even know that is their source, right?
Yeah.
And so just kind of, I guess, having the questions or the conversation around the possible causes to make them feel comfortable, and or just, you know, finally realize that is their trigger.
Exactly.
Because a lot of people don't know what their trigger is, and especially if they've been suppressing it for a very long time, right?
Exactly.
So I like how you were talking about the stress with your adrenals, and how, you know, that has so many impacts over everything in our bodies, right? So what are your thoughts on adrenal fatigue? You think it's real? Your adrenals sit on your kidneys. They're adrenal glands. But they, like he was talking about, you have your mineral corticoids, your catecholamines, your corticosteroids. So adrenal fatigue is something like a lot of people talk about, that they have, they call it adrenal fatigue is what they're dealing with, and they're experiencing different symptomologies and stuff like that. But for me, I'm kind of like thinking that it's, again, tied back to that unprocessed trauma or stress response, or not dealing with their stress levels appropriately. And it's kind of like going back to desensitizing maybe themselves from feeling those emotions, and they're like, oh, well, I just have adrenal fatigue, but I really think it's unprocessed emotions or mismanaged stress.
Yeah.
That's kind of how I think of adrenal fatigue, or that approach to it. When I hear people say, oh, it's just my adrenal fatigue, and I'm like, there's got to be something deeper there that's going on that you're not processing.
Yeah. So there is evidence, and, you know, there are some things that if you ask me, I'll say it's my opinion, but I can cite the words of Bruce Lipton, for example, that does research, is a biologist, that, like, he'll say that absolutely everything, including genetic issues, then genetic mutations have roots in
your adrenals?
stress.
Oh, in stress.
Emotions, yeah.
Okay.
Yeah. So in school, we studied some cases, and a few that I remember, there was like a hypothyroidism, both, Cushing disease, diabetes. Like there were some that I'm like, the blood sugar I can, because of the glucocorticoids, I can, figure. But some of them I couldn't make the connection. And then when it was what Dr. Carlos Silva, he taught in med school, and the guy's a genius. Like he would make the connection for us, and I'm like, oh my God, So yeah, I mean, absolutely everything. And I remember like some that is I wouldn't be able to repeat 20 years ago. But yeah.
The way that the stress is just manifesting and
exactly
unprocessed.
Yeah.
To trigger different sorts of symptomology, chronic conditions, pain, whatever.
Correct.
So that's, I think that there's a lot of people that are struggling with different elements in their life that will put it back to a physical condition, but goes back to that. I guess the root of it is really that emotional piece.
Correct.
So what is one simple daily practice that anybody can incorporate to help deal or process their stress and pain? Like what would be an easy place for somebody to start?
Okay. So I'll answer that. There's one that is like super easy. We can do it right now, like here, wherever you are in whatever position you're in. But I need a little preamble.
Okay.
I'm very careful telling people like add this to your daily routine type of thing. But I think it's really important to say, like, if you're in a terrible relationship, you hate your work, you have like this huge issue inside of your own house, you have like absolutely no peace, the chances of you like shifting something like significant just by this applying like this one like daily practice
that
are
makes
pretty
sense.
slim,
Yeah.
right? So I always say like pay attention to the major stuff. Like if you're miserable somewhere in your life, like look at that. You can get out of your relationship, you can change careers like at any time, right? And I know that sometimes it's like extremely difficult, but in the long run it pays off. Like it's not working the way it is, right?
Right.
Now the science of like switching, kind of like coming back to yourself, is breathing. So we breathe automatically through like some centers in the pons back here, like reptilian brain, that's what they call. And when you breathe consciously, you bring back to like some neocortex, frontal lobe centers, like you do it
it's intentional breath.
Intentional, correct. So it's almost like doing something on autopilot versus intentionally designing something, right? And neurophysiologically and biologically, the breath can just bring your entire nervous system into homeostasis. So there are many breathing techniques, including like hyperventilation type of thing, which I don't recommend, but it's useful and it works. But any like 4 seconds up, hold 3 seconds, 4 seconds down.
Like the box, is that what they call box breathing?
Yeah, box breathing.
So box breathing, you inhale for 4 seconds, hold it for 4 seconds, and exhale for 4 seconds, something like that.
And really, for how long you breathe in and out or whatever, you can play with it. It doesn't matter.
Okay.
Because it'll be intentional anyway. So
just
that's
making sure that it's
from
intentional breath work.
Yeah.
That's the whole point.
Yeah.
Play with it, whatever works best for you, but being intentional about your breathing just to kind of help reset, reground yourself.
Yeah.
And kind of get through whatever, those feelings and stuff that you might have been struggling at that point in time. Correct. Kind of like what you said, this is something that I've been just kind of going off of lately, but like if it doesn't serve you, let it go.
Yeah.
If it's not serving me, okay, I need to let this go. So if it's your bad relationship, if it's, your toxic job, if you hate it, there's this song, it's an EDM song, and it's called Life is Simple. It sounds absolutely ridiculous, but it's one of the things in there. It's like, if you don't like your job, quit, and they like scream it in the song. Anyways, you'll have to go and listen to it. It's so obnoxious, but you're going to be like, yes, that's the anthem, right? If it doesn't serve you, let it go. So it just kind of goes back to being intentional, or kind of just identifying the picture, right? Exactly. Looking at what's your surrounding, what's your environment, what are those things that are triggering you or not helping you to feel your best, to mentally, physically perform your best.
Correct.
Kind of just the awareness of it.
Yeah.
Right. And being intentional to explore those sort of things, or open to exploring those things to
Exactly.
whatever it is that you're, going through.
Yeah. And that's where understanding those things, understanding emotion, understanding these mechanisms can be extremely important, because the book that got like super famous, what's the name? Power Habits? No, Habits. No. It'll come to me.
Okay. Something about habits.
Yeah.
Okay.
So there's a phrase, I don't remember who said, but like, good or bad, habits always produce results, right? Mm-hmm. So bad habits will produce bad results. Good habits will produce good results. But what I've seen is that even with good habits, like if you're in a toxic environment and you like absolutely hate your life, the good habits will not be enough.
You have so much pushing you down, and that's working against you.
Yeah.
Like walking up a escalator going down.
Exactly.
It's so difficult to actually optimize or be successful if you have that constant crushing, right?
Exactly. But then some people do well getting out of the toxic environments, but they have zero discipline. And then the water intake and the way you eat and your habits and your sleeping pattern or abusing alcohol also like won't
manifest.
Help. Exactly. Mm-hmm. So it's a combination. And when I say like understanding the whole picture, is really like the whole picture, like it's like a one thing,
the whole picture.
Yeah.
I think that's so important, because so many people try to compartmentalize things, but you said it early, like with your holistic approach to how you deal or treat your patients with physical therapy. It's a holistic thing. It's your mind, your body, your environment, food, nutrition, water, sunlight, outside, whatever, air quality,
100%.
Toxins, all the things, right? They all go hand in hand and together. And it's like, you kind of have to check all of the different boxes if you really want to be that ultimate or the best version of yourself, and not let those sort of things go unturned.
Exactly.
Spider web.
Yeah.
Go through all of it, right?
Yeah.
Okay, so talk to me. How does postural alignment, or your posture, how does that intertwine with chronic pain? How about we do that?
I love the question, and I'm going to be canceled on this one.
You're not going to be canceled. I won't cancel you. I don't know about what is it, YouTube or Apple?
There's another thing, both by observation, and there's an entire law. When people talk about posture, they're usually talking about like older patient that is aware of it, that has like their shoulders hunched over and stuff. And that has to do with stress as well. So I'll give you like a simple example. When girls start growing and they start like changing their breast size, for example, they usually like hunch to kind of like hide it, right? That can't happen.
I get you. Yep.
So if you force them to like open their chest, it'll be against how they're feeling in their body. So it'll be like an internal fight versus working on the mental cause, and she naturally like will come back to the posture.
So like you're saying, instead of addressing, sit up straight or whatever, it's more of like that confidence to not be self-conscious that you're growing.
Exactly.
Right.
So I want to make this clear. So I'm just like half canceled.
Okay.
I'm not against paying attention to the posture and choosing like the better one, but in my professional opinion, like my personal opinion, I prefer making the person aware. For example, if you're working 11 hours in the computer hunched over, I'm like, Kristen, take a few breaks. Maybe you shouldn't be.
Don't
like
duct tape myself to the chair so I stay
Exactly.
sitting up. Because that's what I'm thinking. I need to be duct taped or something. You know those little things that like will attach you to the chair? No, it's just... Yeah. I always say I need to do that. I see them like I see ads for them on like Temu or Shein or whatever. Doesn't work. No. What you're saying is, instead of that, it's like take a break, get off the freaking computer, stand up, walk around, go to the bathroom.
Yeah.
Be more mindful of that.
Expand on that because it's important. On the surface of cartilages and joint capsules, synovial membrane, we have chondrocytes. Chondrocytes, when stimulated without impact, just with movement, they produce the hyaluronic acid, glucosaminoglycans, that proteoglycans that
Like
lubricate the
cushion
joint.
and lubricate it, yeah.
So not moving is the opposite of that. Your joints are literally drying up, right? So even if you're in the amazing posture, like the body wasn't designed to sit in front of a computer for 12 hours, right? So my point is still like go back to the same thing. Like even if you fix the posture, it's problematic that you're working for 12 hours in front of the computer.
That's the root cause, is that you're sitting there for so long.
Correct.
And not addressing it.
So I still try to give like a broad picture, and instead of just like forcing the good posture.
Right.
So I've had patients that forcibly, they try forcing the good posture and they ended up with more pain.
Because it's just not natural.
It's not natural. And they're like holding with everything they can. It's like, oh, good posture. It's like, no.
Yeah. Like I don't want to get like the buffalo hump thing, you know? I always worry about that.
That's genetic.
Genetic?
Yeah.
It can't be both.
Okay, tell me this.
Speculation.
What about
like,
if you do the neck exercises?
Yeah, but so I've had people with the hump
Yep.
that begged me to fix it. We tried everything. Neck strengthening, the manual therapy, the stretching, whatever, and we didn't.
It doesn't fix it.
No. Now, again, there's like a...
That's definitely legend. So it just comes back to genetics, if you're going to get a buffalo hump or not.
Yeah, and you're
So I can do all the things, and I could still
You
get a
won't get
buffalo
it.
hump?
No, you won't get it.
What do you mean I won't get it? What if it's genetics, you said?
No, but it shows pretty early.
Okay.
Yeah, I can tell like people that are like predisposed to that.
To get the buffalo hump?
Yeah. So the last one is C7, right? The seventh cervical vertebrae. You can see it sticking out.
Okay.
When it sticks out a lot, like you may have like a hyperlordosis, and you know that could be.
So those
the
people are more prone to it.
hyperkyphosis
What can you do to try to prevent the buffalo hump if you're one of those people? Or your
Chin tucks are great.
What are chin tucks?
The one that you show like this.
Like this?
Yeah.
When you do all
Chin
the
tucks?
chins, get
Yeah.
50 chins, super
Yeah.
cute angle. Yeah.
Posterior chain. So the horizontal abduction ones for like rhomboids, mid traps, and then lower traps, you go from down to up. So they help to bring the scapula and the shoulder girdle like backwards like
Those
this.
are the most beneficial for it.
Yeah.
Chin tucks, whatever you said.
Horizontal abductions.
So kind of like flies.
Yeah, reverse flies. Flies forward, like for the chest, and then reverse flies is for the back, for the mid trap.
Okay.
Yeah.
All right. For the buffalo hump. But okay, and we were, this was off camera, but we were talking about acupuncture. So you started being treated with acupuncture
Correct.
a year ago. And you
Yeah.
don't drink anything that's cold.
Yeah, but hardly ever. Like if I can choose not to, I don't.
So you choose room temperature beverages.
Yeah.
Why?
So let me give you a little bit of a background, because if I need to like dive in a little bit of the concept of traditional Chinese medicine, I can, because I studied for 2.5 years.
Chinese medicine.
Yeah.
You're so cool.
I was 3 classes shy of graduating,
What's wrong with you?
and my school went out of business.
Frick.
But if
You're
I finished,
kidding.
I would have to finish at another school up in Fort Lauderdale. It would be like an hour and 20 drive for me, 5 days a week. I will fall back like a year and a half in the curriculum, and the tuition was like 3 times what I was paying
That's
before.
insane. You got screwed.
Yeah.
That's so jacked up. How can they do that?
So, I mean, it's another long story, but apparently can I say that on camera? It's kind of like a little bit of a conspiracy.
You can say it.
Yeah.
The company that acquired the school in 2019 invests heavy in big farm. And the school went out of business like this. Like they just, and it was clear. Like we all knew what was going on.
Big
We're like,
Pharma
this is
bought because they didn't want anybody practicing anything other than Big Pharma.
weird. Yes.
Pharmaceuticals. Drugs. Bianca. Don't do acupuncture. Don't do the other modalities. Stick to the prescription pad.
Yeah.
Wow.
So my
that's jacked up.
acupuncturist is one of my professors, and the
Okay.
guy is a genius.
I've always wanted to try acupuncture, but I've never tried it.
I mean,
I'm nervous. Those needles, but they're
it's
so
amazing.
tiny, right? So it's like not so bad.
No, and really, like, for example, I've gotten zapped before because sometimes you can get like
What do
a
you
little
mean
nerve
zapped?
ending when
Oh.
they go in with the needle. Like they can catch like a little nerve, and you get like this, you know. That's how we do with nerve conduction tests. Like when you do an NCT, you have to put a needle in the nerve, so it's no, you know,
That
foreign
doesn't
concept.
sound fun, though.
No, it's not fun at all. But NCTs suck. Acupuncture, no. So sometimes you could get a little zap, but for the most part, like his technique is so amazing. Like this guy,
What are you doing it for?
prevention.
Okay.
Yeah.
Prevention.
So the concept is completely different though. Like a balanced qi in a traditional Chinese medicine concept is completely different than just our Western view of health, good
Okay.
health. So someone extremely lean and muscular could be unhealthy in traditional Chinese medicine.
Correct.
For them, diarrhea is not a symptom, it's a disease. Headache is not a symptom, it's a disease of one of the meridians. You know?
Okay.
So whenever your qi is not flowing, produce like any symptom.
When you talk about qi, you're talking about like energy in your body?
Yeah.
Okay.
Um,
It could just manifest as different symptomology. So you go and do the acupuncture to try and prevent the headaches or diarrhea, whatever possible symptomologies could erupt from the different imbalances in the energy. That's what
Correct.
you're saying?
yeah,
Okay. And so you learned about the temperature of what you drink
yeah,
as part of this because
Yeah.
it can offset it or something?
yeah. So the qi of the stomach works better with warm foods, right? In general. Some people have a condition that is stomach fire, but it doesn't come without symptoms. Like it actually has symptoms. So you could treat with like cold foods if they have stomach fire.
This
but
is like
it's-
what, really bad acid in their stomach?
This could be one of them. But acid reflux could be a rebellious stomach qi, which is another diagnosis.
Okay, so
And for them
stomach
is it-
fire is the Chinese diagnosis, is what you're saying?
Yes, but the
I've
acid
never
reflux,
is another
Could- it's
stomach. It
another
could be another
diagnosis,
diagnosis. Okay.
yeah.
I've never heard of of stomach fire before, so
Yeah.
I'm just trying to follow you here.
Yeah.
So that's not what they're describing as acid reflux. That's something different.
Correct. It could
Okay.
be. They could be related. Acid reflux could have like some fire to it, but it really depends on another 100 symptoms. Like they're so thorough in their assessment, like you have no idea.
That's pretty cool. I love that.
They literally assess sleeping patterns. I mean, urinating patterns, the color of the urine. The
I want
formation of
to
the-
talk to this guy. I want to learn about acupuncture.
It's really fascinating. I mean,
Okay.
I could help you because I did a good job also simplifying because it's very difficult to understand.
Uh-huh.
There are 5 elements that have to be balanced in these 12 meridians. Each organ, there are like 12 organs in pairs, and they correspond to any of these 5 elements.
So that's why you do the acupuncture in certain
Correct. To
parts of the
balance it
body,
all
kind
out,
of
but
coinciding with like reflexology.
yes and no. They also have the like maps of the body in the extremities.
Uh-huh.
But it doesn't correspond directly to reflexology. It's kind of like
Interesting.
a similar concept.
A different specialty.
Yeah,
Interesting.
yeah.
I love that sort of stuff. So it's really cool to me. And I've
Yeah.
always wanted to try acupuncture, but I've never done it. So we need to try that, Bianca.
And the results are phenomenal because that's what I tell people. Like, I have a little like secret crush in Taoism because I think their philosophy is so beautiful. Like, it's so beautiful, like for life, because it doesn't impose anything. Like, it's not imposing in any ways. It's just like they think life on earth is perfect as it is, you know? And there's this whole concept of the balance, right? Yin and yang, construction, destruction, light, darkness, male, female, passive, active, you know, and that's everything.
All the
So
thing.
the more I think about it, the more I see how that's in the body, right? We have acid and base. What's the name of the tampons that the kidney produce for like to bring like more basic when it needs like to balance out? There's like a name for that.
A certain type of one?
Yeah, like the kidney produce something. I forgot the name. It'll come to me.
Yeah, I don't know. I haven't heard of it. I
But-
know there's like there's obviously the type of cotton, the organic ones. Is that what you're talking about?
No, the body does that. So your pH has to be between 7.35 to 7.45, right?
Yeah.
But it's automatic, like regardless of what you eat. Like if you fast for like 3 days, your body's still balancing acid and base.
If you're balancing it appropriately.
Correct.
Yeah.
Breathing is an example, right? CO2 is acid, oxygen is alkaline. There is metabolism and catabolism. So we see that in the body, you know, like these like opposing forces. And even in the universe, you know, like centripetal versus centrifugal forces, you know, like there's always like this idea of balance. Yeah.
Okay.
So, but the way, like philosophizing about it, like for them is never like nihilistic. So just their philosophy of life is, it's always pretty. It's always like, it's perfect. It's beautiful the way it is.
More optimistic, or positivity instead of glass half full.
Exactly.
Right?
Yeah.
Okay, that's cool. So the room temperature is not to offset the stomach fire.
Yeah.
Or stomach chi. So you don't get stomach fire.
No, that you could have like a stagnation from cold drinks.
Interesting.
Yeah.
Okay, I need to look into this. I love my lit cold.
Yeah.
It's a pro tip.
Now, a lot of people do well with that, you know, like people do well with cold drinks and they don't necessarily develop symptoms. But when you go to the acupuncturist, for example, he's going to read your tongue.
Read your tongue?
Yeah. Just take your tongue out.
Like a map?
He's going to see, like the coating, the color of your tongue, like they give you insights of what's going on in your chi. So that's
like when you say chi, okay, but are we talking about like gut health now or like all the things now?
Everything.
It's like a tongue map to your whole body.
Yeah.
That's cool.
And the pulse. So there are six positions on the right, 6 on the left, and they take your pulse and based on how your radial artery pulsates, they can also like check.
This is really cool.
But and so this is the cool part, because I was finishing something that the philosophy is beautiful, but the applications, like the clinical side of it, is phenomenal. Like it's just mind blowing. I follow Dr. Chen in Doral, and she treats skin problems. She showed me before and afters in her phones. Like when I first got there, I thought she was lying. I'm like, this is made up.
You have to send her thing to me.
We kind of like lost contact, but I could somehow.
But like she's on IG? She's on Instagram?
No. They don't use any social media. They're like Chinese from China. Her and the husband were physicians in China, but they practice.
This isn't she's not an acupuncturist.
She is an acupuncturist.
She is.
Yeah.
But you don't see her. You see a different guy.
I see a different person, yeah.
Okay.
But I was following her in my rotation.
She focuses on more skin
conditions.
issues.
Yes. Correct.
And treats it with acupuncture.
Correct. So
that's pretty dope. That's super cool.
Yeah. When I
Chang, I'm going to look her up. I'm going to go find her. Dr. Chang.
Yeah. When I saw the before and afters, I mean, I couldn't really like believe that she would make that up. And then as I was there, I saw it before my eyes.
When you were in your rotations.
Yeah.
You're like, wow, this is impressive.
Like, impressive. And if you compare to Western medicine, how we treat the skin, like it's so different, you know.
We're gonna give you a cream. It's gonna cause hypopigmentation. Yeah. It's gonna thin the skin. Yeah. Like it's not addressing the root cause. Yeah. You're putting a Band-Aid on something. Yeah.
I mean, a friend of mine has bad acne, and every time he does, he'll do a round of antibiotics.
Of course.
Terrible.
Overutilization. Like I get it. There's a time and a place when you do need it, right? Yeah. But all of the time, no. It's you. Every time you get a sniffle, you don't need a Z-Pack.
Exactly.
I make that as a joke, but it's true, right? True. With the acne, just getting a round of antibiotics every couple of months, it's just crazy to me. Okay, so I love that. She treats it with acupuncture, super cool. We kind of digressed about acupuncture, but I think it's super fascinating, and I love to just talk about that and learn about it. It's super cool to me. Okay, so I had some other questions for you. What did I want to ask you? Okay, so in my daily life, what are some things that I could incorporate, would you say, to maybe if it's not with my posture, because we've already talked about that, but with, help me to sleep better when it comes to from a physical therapist perspective? Would that be like stretching or something, or like what would you say?
You said to sleep better, right?
Yeah. What can improve my sleep?
That's a difficult one.
A lot of things, huh?
It's a difficult one because mainly but there is one thing. So I'll give you the long and the short answer, right? So starting with the short, winding down. There's something that people don't do. If an hour before bed time, you're like taking a bath, reading a super soft book, nothing like super stimulating, low lights, do not touch your phone, don't answer emails. You're not like
you're shutting
working
it off.
on lit to like, like blow it up, like not an hour before bed.
I know.
Right?
I know. Yep. I say
So
this, the
that's
3, 2, 1
one.
rule.
Wind
right?
down.
Uh-huh. Okay.
Now, in a more broad context, I've seen happy people that don't sleep at night. I've seen people that do what they absolutely love in life that they don't sleep at night. So the part of you that doesn't let you sleep is the monkey brain, right? Monkey brain is responsible for your survival. When we were in nature, right? Assuming we were in nature, because there's like a spiritual theory of evolution and there's like the biological one. To me, makes no difference, right? It'll work anyways. We can expand on that, but your chances of surviving depended on what you learned was like safe or not. Now, that mind runs the show 98% of the time, right? That's like the autopilot. It's like when you're driving, talking on the phone at the same time and listening to your favorite music, you don't need to pay attention. It's just going, right? When you're awake at night, it's because it's not shutting down. But shutting down the squirrel brain, the monkey brain, is a skill. It's like building a muscle. And that's why so many people insist on meditation. Because when you meditate, like, it's not really the not thinking, the relaxing, the whatever. Like it's like
it's being intentional.
Correct. But in essence is being able to diminish that, like
all the noise,
like that background noise. And again, it's another subject that there's so much to unpack
there.
But basically, so people that have difficulty sleeping or any kind of insomnia is because they're stuck in that
monkey brain.
Go. State of mind.
You have to kind of just, I say like you have to set the stage.
Correct.
For your sleep environment.
Correct.
And just getting off the screen, forgetting about shutting down the work stuff.
Yeah.
For me, I have like my aromatherapy. First of all,
Excellent.
Doing the warm shower, whatever, having all the lights lower, having the lamp, whatever it is, having the aromatherapy, reading my Bible, just having that time to just kind of wind down and then pass out. If there's things that are on my mind of like work stuff that I need to get done, I need to write it down. So then it's like, I'll see it in the morning and then I can pick it up. Otherwise, I will wake up every couple of hours to try and remind myself that I need to do that in the morning. Yeah. So it's like some people will journal but mine is like put down whatever my to-do list is, put on my to-do list so then I can forget about it until my alarm goes off.
That's very good.
Because otherwise I'll just keep waking up every so often throughout the night worried about I didn't want to forget that thing or whatever those things are.
And you do sleep well?
Oh, when I'm out, I'm done.
Yeah.
Unless I didn't write it down.
Okay.
Like if I am thinking of all the things I need to do.
Yeah, we all have that. I'm also a really good sleeper.
Most of the time, like if it's time, I'm on the pillow and then I'm out of there.
Cool.
Yeah.
That's very good.
I thought you were going to say, I don't know. Like you don't sleep.
Well, okay, if I'm nursing the baby, right, that's interrupted sleep. But if it's not because I'm being woken up by one of the kids, like I don't have a hard time sleeping.
Okay.
Unless I'm worried about something and I'm not writing it down. But I've learned, okay, let me just write it down and then I'm done until my alarm goes off.
That's
So it makes me just feel a lot better of putting it on my list and addressing it in the next day so I don't monkey brain about it all night long.
Exactly.
Right? Yeah. Okay, I have more questions, but I know we need to wrap it up here because we could just keep talking about all sorts of things, right? All right, so we're going to do this because this is fun. I want you to rate these next different things I'm going to talk about. 0 is useless and 10 is amazing. So how you feel about them and your personal opinion. Okay.
It may piss off a lot of people too.
We might get canceled for some of these, right?
Exactly. Yeah.
Okay. Starting with red light therapy. 0 to 10. What are your thoughts?
5.
5? Oh, I love the red light. Okay. Cold plunging.
I'll give it an 8.
Yeah?
Oh.
But not for everyone though.
Not for everyone.
Mm-mm.
Why not?
Because again, back
Stress?
to the Chinese medicine. No.
Okay. It's Chinese medicine.
If you're young deficient, like if you have a cold condition, it's not going to do well for you.
Because it could exacerbate the
Correct.
immune system?
Yeah.
Kind of weaken it, I guess?
Yeah. Weaken. Yeah.
Is this like why people are like, oh, it's cold, don't go outside? Is that the kind of the Chinese medicine thing?
I don't know.
Or is that like cultural?
I don't know where the lore comes from, but it could be. It could be. But
Okay.
yeah.
All right, sauna.
I'll give it a 6.
That's like a 50 to me.
Yeah.
I'm obsessed. I love the sauna.
I know people that love it. They're like obsessed with
I love
sauna,
it. It's like I feel so much better.
Yeah.
I love the sauna. That's definitely a 50. It wasn't even off the charts. Okay, massage therapy.
That's a 10 to me.
A 10. That would be, what do y'all call it? Manual therapy?
Correct.
Right? Do you have PTAs and stuff? Are y'all doing any PIP?
Yeah, we do.
You do PIP?
Yeah.
Okay, so you have PTAs and stuff?
Yeah.
Cool. All right, TENS unit.
0.
0. What is the point of the TENS unit?
Unfortunately, we're so deep into it that it's like too late now to change the mindset. Because
Yeah, it's like you just
like-
prescribe it and then you get paid for it, but what does it do?
nothing. I don't believe in it.
It's-
I've tried it on myself. I've tried on the patients. I've never met anyone that said, oh my God, I love it. It helped me so much. Nope.
No.
But we keep like
We
perpetuating
keep
this thing.
using these TENS units,
Do you
right?
believe in drinking collagen?
In collagen, I would
Yeah,
rather
like
you just give you
ingesting?
full spectrum aminos. I think that's way more beneficial than
Okay.
taking collagen
Good. Because what I learned is collagen get destroyed in the stomach
most of the
and your
time.
body doesn't reassemble it. So I don't understand why we continue taking collagen.
Collagen is more of like, what do they call, like green, I don't know if this is, does this refer to greenwashing or not? I think it's like one of those health things that everyone's talking about it. It's cool, it's popular, but is it really useful? I would say if you give me an option of taking a collagen supplement or taking full spectrum amino acids, I'm going to choose full spectrum.
I agree.
Okay.
I agree.
We can agree on that.
Yeah.
Theraguns.
I'll give it a 7.
I like those
That's
things.
really good for self-care. Yeah.
Yeah?
Yeah.
Okay. Oh, snap. I lost my thing. Hold on. Okay, here we are. Breath work. I know what you're going to say about this.
I'll give it a 10.
Okay, you're a fan. We talked about intentional breathing, shutting things down. Not just breathing, but all of our actions, just being more intentional about them.
Yeah.
To meditate, slow things down, right? Okay, carnivore diet.
I have never done it myself. It makes sense to me. I'll give it an 8.
Okay, vegans. I had to go the opposite spectrum.
Yes. There are so many people that I love that are vegans that it hurts me.
I'm going to get canceled if I talk
know.
about my opinions on vegans.
Look, to me, in my heart, like, and they're super close to me. They're dear to me.
Yep.
I'll
you
give
feel,
it a 0 to vegan.
Mm-hmm.
I love them. Like, I totally respect. Like, if that's what you want to do, excellent for you. Like, be happy. But to me, that's a 0.
Yeah, I agree with you. I definitely say 0, but same thing. If it's working for you, if you feel amazing,
Exactly.
if it's suiting you, if it's serving you, have at it. If
Yeah.
it doesn't serve you, let it go.
Yeah.
Yep.
That song said.
Life is simple. Look it up. You're going to love it. Thank me later. Okay. Hyperbaric oxygen.
I would
For
give
recovery.
it. That's another thing that I haven't done, but as far as the science behind it, I'll give it a 7 or 8.
Seems pretty cool. I've never tried it,
Yeah,
but I
me
see
neither.
like people making like podcast studios and like little oxygen chambers and like,
Yeah.
obviously without oxygen, you're dead. So it's
Yeah,
interesting,
yeah.
right? All right. Restrictive blood flow training. I don't even understand that, but
Yeah.
it's something that you see out there that people are talking about it. I've never tried it.
I'm super tempted to give it a 0. I don't know if I'll give it a 1 just because at least you're exercising. So I'll give it
At
a
least
1
you're
for
exercising.
exercising.
Yeah.
But for the concept, I'll give a 0.
It doesn't make sense.
It doesn't make sense to me
Okay.
at all.
Facilitated stretching.
I'll give it like a 8
I love it.
because
It kind of goes with yoga,
yeah.
right? But
And yoga
someone's-
has a component also of mindfulness, breath, and everything. So yeah.
I love yoga. I love hot yoga. Mixing my sauna life with yoga
Yeah.
and stretching, the just relaxation, but you're still working, right? So
Nowadays there's puppy yoga.
What's
beer
puppy
They
yoga?
bring puppies.
Beer yoga?
Beer yoga.
you're drinking
I'm not
beer and
joking.
doing
Drinking
yoga.
beer.
That just doesn't sound good to me.
I
Downward
know.
dog with beer gut. I don't
swear.
know.
I swear. I mean, there's so like, but
Goat
because, like,
yoga, isn't it goat yoga? I've
Yeah.
seen that where
Yeah.
you're doing yoga and the,
Yeah.
the goat's like on your
Yeah.
back or whatever.
Yeah.
yeah.
That would be
So
fun.
you can twist
But
yoga
interesting.
like any way you want,
Yeah.
just to add something
It's-
new.
Beer
And
sounds horrible. I
Beer
give
yoga,
that a
I'm not. I give that a 0.
yeah,
That's not on my to-do list. Okay, the other things, yeah, I'll try it. But beer yoga, not
Yeah.
my jam. Okay, CrossFit.
that's another thing that may sound so controversial.
Mm-hmm.
I'll give it a 8.
Okay.
I won't give it a 10 just because of the
Injury
amount of
risk.
strain.
Uh-huh.
No, because it's really strain is in the body, but it's not horrible like people think. If you're
If
doing
you
the
have
right
the
thing,
right movements
yeah,
or paying attention to your body,
yeah,
right? They do the CrossFit comps and stuff like downtown. It always looks so fun, and I'd always be interested to like try to do something like that, but I don't. I just worry about the injury
Yeah.
perspective of it. But it goes back to just being trained with the right foundation, making sure you're doing it
yeah.
right technique, I guess
Yeah.
you should say.
You
Or
know what I
should say.
think is cool? Like it puts in perspective the capacity that we have. Like when you compare yourself to the other CrossFitters that are in the same gym, you see how out of shape you are, right?
Holy
Jiu-Jitsu too.
Holy
Jiu-Jitsu too.
chips. Yeah.
Because, for example, it's a common theme in my practice that I ask patients, do you exercise? They're like, yeah. I'm like, what do you do? I walk every day.
I walk
3
to
miles,
the walk
and
to
I'm
the
like-
mailbox.
Exactly. Or like a mile. I walk a mile every day. That's not good enough at all.
I work out. But
Exactly.
I thought that would be good.
Yeah, so that's the thing. So I assume, I can only speculate that this myth comes from like 50 years ago when they used to operate you from open chest, heart surgery, and you would just rest. So when you exercise, you would just like walk, take a few steps. So it was like, medicine was so conservative.
So
of,
conservative and like
none
reserved.
weight bearing, don't exercise, the heart has to rest. And nowadays, like, don't stop, move.
Get up, get going.
Yeah,
Yeah. Okay. MMA.
I love it.
Yeah.
I'm very biased,
I'm
but
biased.
that to me is a 10. I love it. For your body's longevity, it's not a 10. But for Diogo, my opinion, that's a 10. I love it.
I think it's the
Yeah.
confidence, the humility though, like it's humbling for sure.
Discipline, the whole thing.
The
yeah.
discipline,
Yeah.
the cardio. I think it's fun cardio.
Oh, yes.
Because cardio can be such a downer for so many
Yes.
people, but it's a fun outlet for
Yes.
for cardio
Of course.
It's even therapy,
and therapy. It's therapeutic for sure.
You go in there, man. you
Go, let it rip.
Woo!
Let it rip.
Yeah.
Okay. All right. Creatine.
I like it.
Mm-hmm.
I tend to not think that is this miracle that people talk about. Like,
I love creatine.
No, it's
though.
awesome. And the science is really supportive.
It has like the most scientific backing.
More than, what's the other one that people use? The no. What's the name?
What is it?
There's another one. It was like, used to be like creatine, and one is like to help like with muscle breakdown is the creatine, and
It's a supplement.
yeah,
Mm,
it may come to me.
It starts with a
Unfortunately, I have
G?
brain farts. Yeah.
I'm trying to think of.
No,
I'm not sure. I'm drawing a blank
It'll
here.
come to me.
What
But
is
yeah,
it? Did
I
you
would
pause it?
I'll give a 7 to creatine.
Okay, creatine is 7. Okay, and peptides. Do you use them or like for your patients or anything?
I'm
No.
very skeptical,
You're skeptical. I love them.
fortunately.
Yeah.
Yeah. So in it just, right, in personal experience, I've met some dozens of people that treated with peptides.
Mm-hmm.
I haven't seen much.
I'm going to
unfortunately.
say quality of your
I've heard.
peptides
I've heard.
matters.
Yeah.
Because I've treated a lot of patients that are getting their peptides off some online site from China or whatever. And it's like clearly states on there for research purposes only.
Yeah.
Not for humans. This goes back to, are you just going to take this pill that I gave to you and trust it? So, holy chips, why would you inject that into your body, you know? But I love peptides. I feel like with quality peptides, making sure that you're monitoring them appropriately, have a set protocol in place, and being overlooked by a provider, that they can do some really amazing things for different elements depending on what you're struggling with.
It makes sense. It's just like stem cells. It makes sense. Mm-hmm. When we nail it, we are going to nail it. Like it makes sense. I believe in that. Unfortunately, it's like I said, with the people I've been talking to, and I speak to physicians also that I work with, and there's like this consent that is like everyone,
they just haven't had a, it's kind of like a near.
Yeah.
Not so sold yet. Yeah. Okay. I love them. I definitely have seen them do some pretty awesome things. So
well, that's good to know.
I'm
happier thinking that it works than that it doesn't work. Like I was disappointed that it didn't work for the people that
it's going to, I think, what is your dosing, right? Where did you source your product from? Are you on the right dose? Are you doing the right combination of modalities? Like I can't sit here and do all the healthy things, but then go binge drink and think I'm going to get great results, right? So it's like, what are the other pieces to that puzzle? And are you addressing them? Are you addressing those underlying stress or the emotional things that could be hindering your healing process? So that's a lot of different components there, but I do love peptides. Okay, we could just keep going on and on, but the name of this podcast, Diogo, is I Need More From You. So I need more from you. You need to tell me, what are you doing next?
I'm in an expansion phase.
Expansion phase? What does this mean?
The clinic is growing.
Okay.
Like I'm starting to show the book and talk about it, you know. Like I said, I was invited at FIU for the lecture and stuff, so I'm always on to something. Like, because I didn't finish the traditional Chinese medicine.
Are we going to go back and do that again at some point?
Under these conditions, no. I'm not going back a year and a half and paying 3 times tuition. And
you're going to wait. Pause on that.
Yeah.
Okay.
That thing has changed my life. I became a dry needler. So I'm
really cool.
licensed to put in needles.
Really?
I just can't apply the entire like holistic concept of Chinese medicine.
Dry needling and acupuncture I thought that was like the same thing.
They're different.
One has a certification?
Yeah. So dry needling is a specialty of PTs.
Okay.
And it's like a 52 hours training to be certified, and you need to pass like exams and reports to the state. So I'm fully licensed to do dry needling. My acupuncturist says it's acupuncture. Like, he's confident. He's like, you're putting needles? That's acupuncture. You know?
Yeah.
But I couldn't, for example, check the patient's tongue and the pulse and say I'm fixing like your meridians type of thing. That would be like, I'll be presenting myself as,
okay, that'd be different, a different scope.
Yeah.
Really interesting. Okay, so I interrupted you because I wanted to know what dry needling was. So back to, what
comes next?
Yes.
Yeah, so Steffi is certified in a technique called RT, rapid release technique, I think it is. The person that created it is a psychotherapist, John Connolly. I love what he does, and I can become certified in RT. It's very similar to what I already do in the clinic. It's just like how you assess and how you bring out the emotions and how you deal with it type of thing. It'll be, I'm not sure if that's where I'm going. That's also heavy, like in hours, and like it's a lot of work. The whole like certification thing.
A whole other certification process.
Yeah. But the next one will be most likely in this.
An RT certification, something like that.
Yeah, psychology, psychoanalysis.
And you said expansion, like another location, or just expanding your certs? Both. And another book too while we're at it?
I already started it.
Of course you did. Of course you did.
Yeah.
That's super cool. So you have a lot of things that you're cooking over there.
Yeah.
I love that. Well, this was so much fun. I always learn so much from you. You're just multifaceted, you know, a lot of things we align on, and I just appreciate you sharing your knowledge and your expertise. I want you guys, you know, if you need any physical therapy, dry needling too, you do see patients only for dry needling?
Yeah.
Yeah? Okay. If you want to check him out, Physical Therapy Now, Sunset location. If you want his book, we'll definitely put the link in our show notes. You have a website or IG? What's the best? How can people get in contact with you?
So it's a franchise system. So the directory will come out of Physical Therapy Now. So they have to find my location, the Sunset. But a lot of people are finding me directly on Instagram.
Perfect. What's your IG handle?
It's Diogo Trevisan, my name, .pt.
Perfect. Okay. So you guys can reach out to him on Instagram. He can hook you up, get you set up if you need physical therapy or some of his other service offerings at his clinic. You can pick up his book. If you guys liked today's episode, make sure that you hit the subscribe button. Thank you so much for joining me today. As always, it's a pleasure. Thank you guys so much for listening today. Subscribe so that you can hear more. This podcast does not establish a patient-provider relationship, nor is it medical advice. If you'd like to see me as a patient, please contact my team so you can thrive.